like to thank Mayor Walsh for taking such a courageous lead on such an important issue as this one, and not only to the city, but to the whole state, critical issue, and for asking us to partner with him on something that we know matters to him so much personally. We had a great advisory committee for this project. I thank all of them who participated, engaged, and worked so hard on putting together this report and our findings and our recommendations, and also the city staff who worked with us. And finally, we had a great consultant partner, DMA and Dick Doherty. I thank them for sorting through the volumes and volumes of data, trying to get some accurate picture of the situation in the city and getting input from so many individuals. We got the request from Mayor Walsh to partner with him on a priority as he entered his new administration to really improve access to substance use disorder services and treatment recovery services throughout the city of Boston. So I thought, okay, that shouldn't be that hard. That should be fairly straightforward. I'm sort of like an analytic type, so I'm thinking, okay, we'll figure out how many people need these services, what's the capacity within the city, do some math, what are the gaps, and then figure out what's the roadmap to get from where we are today to where we want to be. Boy, was I wrong. The complexity became apparent right from the start. And just like a statewide effort to look at some of these issues right before we started our work, there is very little good data on either the need for or the capacity of substance use disorder treatment and recovery services. And I have to admit, that was a shock to me. The only data on need is the National Survey on Drug Use and Health, which is a national survey. By juxtaposing some other data on it, we were able to break it down by region. The only data on capacity or where there are services is through the Bureau of Substance Abuse Services at the State Department of Public Health, and that's only on services that they license. So it's beds, which is a huge portion of the network, but it's detox beds, it's residential treatment beds. So we had no data on outpatient services, recovery support services. It doesn't exist. There's a phrase, you don't want to stomp on your own message. So, but I would say this is one of our major findings in and of itself. The fact that we have such a significant problem, whether you're talking about opioids and heroin or alcohol or anything in between, and we have no data to better understand the issues themselves and the interventions that need to be put in place to address those issues is a crime. I mean, we have got to address this issue. We are not going to be able to make progress if we don't have good data. So there's my data pitch. So we decided from the start that we'd collect everything that we could in terms of quantitative data, and then we'd augment that with lots of qualitative data. And again, thank you to all of you who participated in this. We had the 30-person advisory council who met several times and really contributed. Every single member contributed very substantively. 11 focus groups, which included over 100 people, most of whom have lived experience, and then 29 face-to-face interviews. I see the consultants laughing because when we hired them, I said, oh, maybe you could do like 4 interviews. Again, I was wrong. By using both of these methods, I think we're able to tell the story of what we need in the city of Boston to get to what we know is the mayor's vision of a really high-quality, accessible system of care for people with substance use disorders. So let me tell you what we do know about need. The prevalence or the extent of substance use disorders among people, residents of the city, is pretty much the same as it is across the state. So it's about 11.3%. So 11.3% of residents of the city have substance use disorders. Another fact, close to 10% of all Boston hospital ER visits are substance abuse related. And roughly 5% of all inpatient admissions are substance abuse related. So we're talking about a major problem. Alcohol and heroin, unfortunately, are the drugs of choice for Bostonians. The rate of alcohol abuse is very high in Boston. 25% of Boston residents report binge drinking, and 10% report heavy drinking. The rate of unintentional heroin overdoses among Boston residents increased by 76% from 2010 to 2012. And the heroin-specific calls to Boston EMS increased 25% between January and mid-November of 2013. At the state level, where there's a little more data, We can tell you that between 2000 and 2012, so between 2000 and 2012, the fatal opioid overdoses increased by 90%. And they are projected to have increased almost 50% between 2012 and 2013. These statistics are so sobering, but yet substance use disorders are preventable and they're treatable. Addiction can be managed successfully, not easily, of course, but successfully, but only if treatment and recovery services are available. And the story we heard was that too often that's not the case. So in terms of capacity, what we were able to determine, and what, again, makes this problem so complex. Again, Mayor, I really applaud you for taking this on because it is very complex. The treatment system in Massachusetts is a statewide system. So while Boston has a significant volume of detox beds or residential treatment beds, at any given day, more than half of them are filled by people up from outside the city of Boston. So it's not that where you live it relates to where you get your services. So it's very complicated to look at, sort of the capacity of a given area and the residents of a given area. Some of the programs in the city are run by the city, but most of them are run by the state. So again, very complicated system. We know that the detox programs in Boston are operating at full capacity. We know that wait times for residential placements averaged approximately 23 days in 2014. So when you think of someone who's ready, in that moment, ready to enter treatment, and then so they're told they have to wait 23 days for a bed or a service. So it was very clear among the advisory committee members, even though there wasn't tons of data, between the data that we have and their own experience that they brought to the table, that the city needs more